Hi, and welcome back to Type 1 Diabetes Explained. Today, we're going to talk about the patches and adhesives that can be used to help keep your insulin pump or CGM securely attached to your body and how to safely use them. This video is not talking about the experimental patches researchers are trying to develop to deliver insulin directly to you, or patches that claim to help you lower your blood sugar. Today, we will just be talking about the adhesive patches designed to help keep your diabetes devices attached to you. When you use a CGM or insulin pump, they come with a small ring of white adhesive tape built into them to help keep them attached to your body. But you might have noticed that that ring of adhesive material is pretty small, and the adhesive itself is not very strong. If you lead a particularly active lifestyle or sweat a lot, especially during the hotter months, then you might notice the adhesive peeling away from your skin, which could cause your pump or CGM to fall off. This situation is obviously not ideal, especially for CGMs that often need to stay on for over a week. So, to prevent this from happening, you can use additional adhesive patches to help keep the devices securely attached. There are several options available to you. First, some companies make additional adhesive patches that are specifically designed for your diabetes technology and are pre-cut to fit perfectly around them. These patches come in a variety of colors, and some even have special designs or patterns. These patches can be ordered online and shipped directly to your door. Alternatively, some people may prefer to use medical adhesive that they can cut out themselves. There is a wide variety available, but it's recommended that you choose a gentle fabric or paper-based tape to avoid damaging your skin or medical devices. These types of tape can also be ordered online or found at almost any pharmacy or grocery store. You can then use a pair of scissors to cut out the portions that you need. If you're in a pinch and don't have any extra adhesive available, Band-Aids are a good temporary solution to keep devices attached. While you shouldn't use them as your main adhesive, they can help keep a device attached for short periods of time, and are often easier to find than medical tape. If you're worried about devices falling off while you're away from home, always keep a small roll of tape with you. They're easy to fit in purses or backpacks and always good to have on hand. To make sure that it doesn't get damaged or contaminated before using it, it's a good idea to keep it in a sealed plastic bag. Extreme heat can often degrade adhesive as well, so don't keep tape in the car during the summer. Now that we have talked about different types of adhesives that are available, we can look at how to use them properly. The most important thing to remember when you use these patches and adhesives is to apply them when your skin is completely dry. If your skin is wet for any reason, the adhesive may not bond properly and will likely fall off later, possibly taking your medical device with it. To avoid this, always apply patches at least 2 hours before or after your skin will be wet. This includes showering, swimming, or working out. Believe it or not, the upper layers of your skin can absorb some water from your surroundings, so even though you may be able to dry the surface of your skin after it's wet, some water may still be trapped that can damage the adhesives when they're trying to bond. If you absolutely need to apply a patch after your skin has recently been wet but don't have 2 hours to wait, you can try using a hairdryer on a cool setting or a fan to help your skin dry off faster. As with any adhesive product, none will be perfect, so you may find yourself in a situation where your patch is peeling away from the skin. This can occur more frequently if the patch has been wet for long periods of time, like if you go to the beach or a swimming pool. If this happens, you may want to apply another patch or adhesive over the one that you already have on. In order to do this, wait at least 2 hours to let your skin dry and the current patch dry completely. Then use a pair of safety or bandage scissors to carefully cut away the portion of the patch that is no longer attached to your skin, and then apply the new adhesive. Some companies also make liquid adhesive that can be used as a type of glue to reattach or reinforce patches that are peeling away. Always consult your doctor about what types of adhesive will be best for you. If you use these adhesives properly, then you may find yourself with the opposite problem. When you're ready to remove your medical device, the adhesives may still be strongly attached. There are several methods that can be used to help make removing them easier. First, soap and water are often the go-to methods to help gently remove adhesives. If that's not enough, then makeup remover liquid can also be useful to help break down the adhesive and make it easier to remove. Simply use a gauze pad to apply the liquid to the patch and gently apply more as you peel it off. Another tip that can make removing patches easier is to shave the area before applying the device. Hair, even if very small and fine, often contributes to most of the pain when pulling off adhesive products, so having these areas smooth and clear can help when it comes time for removal. It's important to remember that the skin can be a very sensitive organ, so some of the techniques and products that we discussed in this video may irritate or damage some people's skin, even if they're used properly. Talk with your doctor or a licensed dermatologist if you find your skin is becoming irritated or appearing abnormal due to your diabetes treatment, as they can often provide alternative solutions or prescribe topical medication to help reduce irritation. Hopefully today's information was helpful and you learned about some useful resources to help keep your diabetes devices securely and safely attached. Thanks for watching, and as always, have a great day.